So hi. So today's our topic is remaining nerves of upper limb. That is your median nerve and as well as ulnar nerve. So first of all, we will discuss median nerve. So median nerve is root value is your again like radial nerve C5 to T1, C5, C6, C7, C8 and T1. Median nerve formed by the combination of medial and lateral cord. Okay, that combine to form a median nerve. So median nerve runs first off in front of your axillary artery, then it's come lateral to the axillary artery. Okay, comes lateral to axillary artery, then again it's mid of the arm, it's come medially and run medially in the your cubital fossa. Okay, medial content of cubital fossa, that is your MBBR or MBBS, whatever. That median nerve, biceps brachii tendon, and B means your brachial artery and your superficial radial nerve. Okay, so it runs medially, then it's not give, neither it's give branch in the your axilla nor in your in arm. So it will give branch only in forearm. So what are the forearm branches? It gives superficial branches to the superficial muscles and as well as deep muscles. So superficial muscles, which superficial muscles? Those are your muscles, that is your pronator teres. So it passes between two heads of pronator teres. Okay, so two heads of pronator teres it passes and give branch to the pronator teres. Pronator teres branch coming from above only. Okay, then also it give branch to your palmaris longus, then as well as your flexor digitorum superficialis, flexor carpi radialis, all this muscle. Okay, then it's give a branch, that is your deep branch, that is anterior introsseous nerve. Anterior introsseous nerve give branch to your flexor digitorum profundus, that is your lateral half. Then your flexor pollicis longus muscle, and as well as a pronator quadratus muscles, that deep muscle, that is your pronator quadratus here. Okay, that quadrangular muscle, pronator quadratus. Okay, so these muscles, then it will pass deep, your median nerve pass deep to the your carpal tunnel. Okay, carpal tunnel, but your it's once one of your superficial branch, palmar branch that pass only superficial to that, so that palmar sensation will not go in carpal tunnel syndrome. Okay, because the superficial branch give that passes about to the your carpal tunnel, so palmar sensation will be intact. Okay, this palmar sensation is intact here. Okay, palmar sensation intact here. Okay, then but your digital sensation will go on the carpal tunnel syndrome, because digital branch give after it passes through beneath the your carpal tunnel. Okay, so what is the carpal tunnel syndrome? Carpal tunnel syndrome, that is your due to the compression of your carpal tunnel, its nerve become inflamed and edematous. So main reason of that may be the your rheumatoid arthritis, diabetes, and obesity. All that may be the secondary causes of the your carpal tunnel syndrome. So what are the symptoms? Symptoms mainly, pain will be there. With the pain, there also be tingling, numbness in the hand, tingling, numbness, and loss of sensation. Okay, and paresthesia. All these symptoms will be there. Then After this, what are the treatment of what are the diagnostic tests? Clinical test. One of the sign, tenal test. Just tap that, and that will cause your tingling, numbness, and paresthesia. You tap like this, tenal sign, and one of the your phalanx test. Okay, it also causes aggravation in the symptoms. Phenol test, and other test is your electromyography. All that may be done for the diagnostic purpose. The treatment mainly you can say it is uh, medical treatment also can be given, and steroids injection can be given, or and shades can be given. Then if it is not relieved, then of course we go towards surgery is the last option. Then or other thing that if injury of your median now, if it is injured around the elbow, what will happen? Your deep muscles will go, flexor pollicis longus, and as well as your flexor digitorum profundus medial lateral half. All this will go on if it is your nerve injured here. So if it is your this flexor, this abductor pollicis longus gone, okay, and if it is a nerve entry, if it is injury at the palm, around the elbow, there will be what are the sign will be there. So there this thenar muscle will be one of the your thenar muscle, that is aponeursis longus, okay, that will go. So opposition of your thumb will not happen like this, like this it will not happen. Opposition of thumb upon his longest muscle will gone, okay. So this opposition of the thumb will not happen. So your thumb will become like this, that is your ape thumb deformity. Occur if it is nerve injured here on the elbow. Again, if it is your injury of anterior introsion, no, your flexor pollicis longus will gone, and as well as your medial lateral half of your flexor digitorum profundus also gone. So normal person will make okay like this, but here your due to these muscles will gone, so your interphalangeal joint will not flexed properly. So okay sign will be like this, flat okay sign in the your anterior introsus nerve injury. Other than that, what will be there? Some other test we can do in the one I told ape thumb deformity. One thing is, if a nerve injury occur around your wrist or above, one thing is that if it is your flexor digitorum profundus will go on, then if it is injury above, flexor digitorum profundus will go on. So but your medial half of flexor digitorum profundus is still intact. So patient will able to flex these fingers, but your index finger will not get flexed. So that is your pointing index sign due to your flexor digitorum profundus gone. Pointing index sign. Okay. So all these signs will be there. So our median nerve is, I think, main points is over. Okay. After median nerve, we can go to the or ulnar nerve. Ulnar nerve root value is your C8 and T1, and it runs medially to your between the your axillary artery and axillary vein in the axilla. Then it's come medially, runs medial to the your brachial artery. Then it crosses and it's passes through the intramuscular septum. Then it's go behind to the medial epicondyle, behind to the medial epicondyle. Then uh, runs between the two heads of your flexor carpi ulnaris muscle and runs over the your medial half of flexor distal profundus, or then go below around with the your ulnar artery. Then with the ulnar artery, it's passes distal to third and then go like this, and it's give a superficial to branches like your ulnar cutaneous nerve as well as your dorsal cutaneous nerve. Then it's go to passes through one canal, that is your Guyon's canal, and then comes like this. You want to make a arch and this end to supply to your flexor pollicis, adductor pollicis muscles. Okay, end to supply your adductor pollicis muscle. Okay, only thenar muscle that is supplied by your ulnar nerve. Okay, so ulnar nerve will give branch muscle here. Two muscles. One is your flexor carpi ulnaris muscle, that's for sure. One of the flexor muscle, only flexor muscle that's supplied by your one of the flexor muscle that's supplied by solely only muscle that is supplied by your ulnar nerve. Then medial half your flexor distal profundus. Okay, then it's your palm, it give palmaris brevis, branch to the palmaris brevis, and one I told two superficial branch. One is your palmar cutaneous nerve that's supply the palm, skin of the palm of this side, one and one this little finger and half of this ring finger. Okay, supply this, and dorsal cutaneous dorsally. Okay, this side, one and half. Okay, then your palmar cutaneous as well as nail bed, including nail beds of. Okay, so these are the supply. Then your one of the muscle I told that is supplied to the your palmaris brevis. Then you give the branch to the your introsseum, all introsseum muscle, dorsal, palmar introsseum muscle, and your medial two lumbricals supplied by your ulnar nerve, and lateral one you supply by your median nerve. Okay, lumbricals, two lumbricals, all introsseum muscle are supplied by the your ulnar nerve only. Then end to supply the your adductor pollicis longus muscle here. Okay, so it is one of the main nerve of hand. Okay, so supply all the introsseum, two lumbricals, so it's the main nerve of your hands. So it is called the median nerve. Your ulnar nerve also called median nerve. Okay, median nerve. So these are the main points about the ulnar nerve. So ulnar nerve test mainly your card test, one of the test, or testing your introsseum or these muscles. Okay, your card test give, suppose this is your cards. Okay, your card test, and as well as your book test. Suppose this is only your book test. This test like the book test and card test or ulnar nerve. Okay, so then Igawa test also. Okay, for your DEB is dorsal for abductors, PED your palmar for abduction. Palmar is adduction, dorsal your abduction. Okay, Igawa test. So these are the main tests in the ulnar nerve. So these are the main thing in these two nerves. If it is anything remaining, that is remaining, but main points I told. Okay, so goodbye for today. Okay.